Ladies and gentlemen, I would like to give you all the opportunity to address questions to Dr. Simka and to Dr. Godley. So please proceed with questions.
Well, I have quite a few questions, if I may, maybe here. So what you said, if I understood well, is that you don't know if this will really help. It might help. Is that what you were saying? So it's not a sure cure? Or?
Actually, this topic is very new. The only published paper comes from Italy, and Italian doctors observed multiple sclerosis patient after the procedure, the vascular procedure for this pathology after 1 year and a half. And they found improvement in most of them patients. However, this period is rather short, and we don't know what will happen after 5 or 10 years. So we cannot say for sure that it might be a treatment in the long term.
But in
maybe yes, maybe no.
In medicine, don't you have to prove something before you start using it on patients?
Yes, but to prove something, you should do something first and then have results.
A good example of that question would be ulcers in the stomach, gastric ulcers or duodenal ulcers. For years, we offered treatment. And it was only in 1983, 1984 that it was discovered what was causing the ulcers, and that was a bacteria. Nobody believed a bacteria could live in the acid of the stomach. And again, what we are saying here is that we need to offer this as an alternative for patients who have symptoms of MS.
What are the dangers of doing this procedure?
In our facility in Poland, we've already managed over 100 patients, and we had no serious complications. So we can say that this procedure is very safe. Of course, complication can occur, but is very unlikely. On condition that the surgeons who are performing this procedure are not very aggressive. They are rather conservative, managing only obvious pathology found, and on this condition, this procedure is safe.
Is it expensive for people to? It's not allowed in Canada or in the US, so people have to pay. So how much does it cost?
Well, I think this depends on local condition. In our department in Poland, this procedure costs about 1,000 euros. So it would be in American dollars with about 7,000, I think.
7,000, yes. And I have a question. Are you working in this clinic, doctor?
Yes, I'm the medical director of this facility.
And how much would this procedure cost?
The procedure, we will have no idea because we cannot perform the procedure in this facility at this time. However, we do know in this facility what it costs to at least get the diagnostic tests done, and that is $2,300.
Dr. Simka says this is a very difficult thing to diagnose.
Yeah.
For people here in BC and Vancouver, what sort of training are your doctors getting to ensure an accurate diagnosis?
Well, the most important thing is that the radiologists are performing the actual Doppler imaging, and the radiologists are reading the MRIs. These are trained physicians who are experts in their field, in their subfields of radiology. So with the collaboration with Dr. Simka and his experience through all the modalities of treatment, from venography to MRV to the Doppler, and taking all of that information and collaborating like we have over the last 3 days, our physicians are able to gain very good insight into this disorder and insight into learning how to make the diagnosis. So this is an ongoing learning experience for us all. And it's taken us many patients to get to this point, to be able to say, we were first to offer it, and we will do our best to carry on providing this service.
So, doctor, what is the percentage of success? Let's say, do you have any data on that? Does it work?
The answer is not very easy because we have very early results. Most of patients reported improvement, at least in some symptoms. Usually they reported that chronic fatigue, headaches, trembling, problem with bladder disappear or at least improve. However, it is not seen in every patients. Sometimes this improvement is better, sometimes not. So this is very difficult. And as I've previously said, we have no long-term results. So this question is still open. I think in some years we will know more about this problem. Nevertheless, this issue is very promising.
So in few words, I'm sorry, could you repeat again, what is the procedure? What would the surgeon do?
Okay, Dr. Simka will.
So we can understand.
So at least in our center, first we start with a diagnostic test. It consists of Doppler sonography and magnetic resonance venography to know if there is a pathology, and if there is, where it is situated, what degree of pathology is found, and so on. Then patient, of course, after consent, is performed standard venography. It's standard venography. Venography. It's an invasive procedure. It consists of placement of thin catheter into the venous system, injection of dye, and after this diagnostic test, we can know for sure if there is a problem with the venous outflow from the brain or spinal cord. If the problem is found, we try to, usually there is a stenosis in the venous system, we try to dilate dilate the stenosis with special balloons. If it works, it's enough. The procedure is done. If it's impossible to dilate the stenosis with the balloon, we put a stent in this area to fix the problem.